We are talking about how to get a patient admitted to hospice without a specific disease. I'm excited to talk about a recent study by Dr. Anita Meyer with Hospice of the Northwest that will help us admit these patients. But before I do, I want to give you a bit of history, hospice history, which will help you see the value of this current study and information. Years ago, in the early 2000s, when people were being admitted to hospice, there was an admission category or ICD code called debility and decline. It was used for those older persons who had become frail and they were in a general spiral of decline. Like I spoke about in the first video, they were weaker and so forth. And a couple of things I didn't mention about those people are really important. Oftentimes, it had to do with the fact that they can't manage their medications, and those were imperative to their stability. And a very large category would be the people who had cognitive or mental decline, Alzheimer's or some dementia, and they aren't even aware of their disabilities or their inability to care for themselves. So in the old days of hospice, we admitted those patients because it was clear they were in a dying spiral and their physician and the hospice provider recognized it. We used this designation that Medicare recognized called debility and decline. Well, it was a vague criteria, clearly, and it was not always used correctly, and people were getting admitted to hospice too early or just incorrectly. So Medicare discontinued the use of that admission code and the criteria because it wasn't specific enough. So what happened? The problem is people they die this way. They decline, a general decline of human function, and without a specific disease process still happens. So how do we prove to Medicare that they deserve hospice care? In the next video, we'll talk about a very important study that has led to this new evaluation tool. So stick with me, watch the next video. Please visit our website, the Hospice Care Plan, and our YouTube site with so many videos to help you with end-of-life care, the Hospice Care Plan. And remember our motto, care is treatment.